My name is Chao Po Kong. I'm the head of marketing of Port Technology Asia. Thank you for giving me this opportunity to share with you our ideas and solutions, especially in this uncertain time. For many years, we saw the rise of problems faced in today's healthcare industries. Asian population, global shortage of doctors and nurses, rising medical bills, and now the pandemic. Waiting time is getting longer, and public hospitals are overcongested with patients. We visited some hospitals in Vietnam and found out the average waiting time can be as long as 4 to 7 hours. We strongly believe that with today's technology, smart sensors, 5G, blockchain technology will be able to put together a solution to assist doctors and nurses. We are certain that we are able to improve healthcare accessibility by 50% and reduce the deployment cost by 70%. That's the reason we went ahead to design, develop, and launch Pod Solution 2 years ago.
Doctor is proud to bring these new technologies to Vietnam because we have been working with hospitals for a long time, and we know exactly what's the problems with overcrowdings and the problem of waiting time in the hospital in Vietnam. And this technology is actually coming at the right time to solve the problems that we think will bring a new era to the healthcare.
This pod machine indeed is very revolutionary. We do see this as a disruptor for the healthcare community and the services. Part of Pfizer, we are very happy to be part of this initiative, and we hope to see better and more collaboration through different markets in the near future.
Sẽ rất là tiện cho bệnh nhân vì các chỉ số của bệnh nhân sẽ được hiện lên ở trên màn hình. Từ đó người ta sẽ biết được các chỉ số của mình và rất dễ bớt các khâu cho bệnh nhân.
Theo tôi á, thì cái máy này mỗi lần bệnh nhân đến đo thì rất là tiện lợi, nhưng mà có điều là phải có người hướng dẫn. Tại vì thật sự lúc đầu nó cũng hơi phức tạp, nhưng mà có thể qua 2 lần hoặc 3 lần thì bệnh nhân sẽ tự được thao tác và bệnh nhân biết được thì sẽ dễ làm hơn.
Very good.
Our debut in Vietnam is a success. Waiting time has decreased by 35%, and each port is able to relieve up to 4.5 manpowers. This gives us the confidence to roll out port beyond the traditional channels. With the integration of self-diagnostic machine, teledoctor, and telemedicine, we see a future where our solution resides in high-populated areas, such as office, residential, school, subway station, shopping malls, airports, and rural areas where accessibility to good healthcare services is limited. Providing better availability and accessibility to healthcare, patients do not need to crowd at the hospital. It reduces congested traveling time and waiting time to see a doctor. Also, during the pandemic, where overcrowding may increase the risk of infection, for non-chronic patients, they are able to get their body checked, see a doctor, and get their prescription remotely and instantly at their doorsteps. Working with Intel and other health tech product manufacturers allow us to build better, lower cost, and more efficient healthcare solutions. And partnering with local communities, government, pharmaceutical retail companies, insurance companies, land developers, foundation, and teledoctors group will help to speed up, expand, and widen the deployment of this new healthcare solution for everyone.
Having the opportunity to work with Port in my previous role has really allows me to see how flexible and innovative this platform is. Well, in my current role, it allows me to think a little bit further. With the current COVID pandemic, it really allows us to reimagine work. Today, work is no longer a place, right? And the way we approach work is very different as compared to 2 years ago, right? In such a scenario, or I would say in this new normal, we are hoping to provide our staff a more conducive working environment, trying as much as possible reduce the risk for them to be exposed to high-risk area. I mean, if there's a small home emergency, whether that's an allergy or a common cough, I would rather go to a remote healthcare provider or a platform such as Port, where it has diagnostic device to capture some of the vitals and provides me the right, I would say, home emergency medicine, rather than going into a high-risk environment such as a clinic or a hospital. And that provides, if you think about that, it's really versatile on how you could leverage a platform like this. Let's say in a plant, where maybe in that plant we have multiple levels or we have multiple sections. And it could be one section that was being affected or impacted. And we might need to undergo some kind of semi-lockdown. So in this scenario, Ports allows us to contain such area, provide some minimum health care, as well as reduce the number of people cross-infection between the different section or plants, right? The other part is also that if you look at how the government is responding, such as Singapore, they are saying that, they are really thinking out loud that how are we going to live with COVID. It really needs us to reimagine how do we travel. Do we travel to every place where we have a mentality of we might be quarantined for 7 to 14 days before we get released, and as we go back to a place of origin, we do that as well? Or could be very soon we have fast quick test kit where it could be deployed in Port where Port is just a machine where, you know, it's like scanning your bag and it's like scanning your health. So you just sit there, scan your health, show your vaccination passes, get your passport stamp, move on, board the plane, go to the destination, then you go through another Port machine again, do the same different vital tests and PCR tests, quick tests, and scan your documents and being released. So that, if you think about that concept, maybe that's a possible scenario of how we will live with COVID in the near future as border opens up and the economies open up and we get to travel. So it's very interesting. Stay tuned. I'm very excited and very happy for Port and for letting me to be part of this, I would say, effort in changing healthcare. Thank you very much.
At Port, we see ourselves as more than just a hardware company. We see ourselves as a new unified platform that empowers everyone to be more independent and to take better control of their health records. At the end of the day, we want our patients to know more about their own health. No more fragmented medical records in various places. We see a future where your health records are all consolidated in our user's phone and only accessible by them. After all, POD stands for Personal Online Docket. Thank you for your time. We look forward to work with you. Just before I end today's presentation, I would like to share with you another innovation that we deployed in both Vietnam and Singapore during the pandemic.